There are several reports in the literature now that have identified male fertility problems after having COVID. So we're particularly concerned with that. We don't know what the long-term effects are because COVID has only been with us for a relatively short period of time. But we're going to be looking at that, as others are, very closely to determine if there's any long-term potential consequences. COVID seems to decrease the parameters that we use to identify healthy sperm in men. It looks like they have poor sperm counts. And with this, we don't know whether it's temporary or whether it's going to disappear over time. In men, generally it takes about 72 days from the time sperm begin production to the time they're ready for fertilization of the egg. If that's a time period in which they had the infection, we're not certain yet if that's the only damage that has been done and whether it's during that time period and whether it's temporary or not. Once a male presents to us after having had COVID, we treat him like most of our other infertility patients. If their sperm counts are diminished to the point that we need to do treatment to specifically overcome those effects, then that's what we do. For instance, we may do artificial insemination, or if the sperm count is even more severely affected, we can do in vitro fertilization with intracytoplasmic sperm injection. People who have had difficulty conceiving and have had COVID should probably come in for an evaluation just to make sure that there hasn't been any residual effects of the disease on their reproductive system.